Dr. Lavina, tell us about Ave Maria Palliative Care.
Ours is a 15-bed hospice facility in Mangalore. We are operating in Wamanjur, Mangalore, in the outskirts of Mangalore. The services are open to people of all faiths, all religions. A majority of our patients are Hindus, and we have Muslims as well, and Christian patients too. So we provide holistic end-of-life care to patients. There are nurses, there is a visiting physician, there is a chaplain assigned to us. There are caregivers, housekeeping staff, social worker, counselor. So physical, physiological, psychological, spiritual, legal needs of people who are in the end stages. We try to address all these needs that the patients have. We also work with families to help them prepare for the departure of their loved ones, because that's also very important. Most of our patients are very young. They suffer from oral cancers, and they are in between 33 and 45, which means they have small children. So even the children and their spouses have to be prepared for a dignified death. So we have been operating since 2008, and as of today, we've catered to about 812 patients. Most of the time, we just give them symptom relief. We cannot cure their illness. Majority of our patients have cancer. We also take care of patients who have liver cirrhosis, liver failure, kidney failure, dementia, or other neurological conditions in the end stages. So basically, when there is no cure possible, we provide them care. We don't do euthanasia. We don't extend their life. We don't cut their life short either. We don't have ICU facilities or machinery or equipment to keep them alive after they are dead. But death happens when the heart stops. So there is no resuscitation. And there is no CPR given to them. There are no monitors to keep them alive after death. So it is a nice way of meeting one's end in a dignified manner. And we strive, it's a team approach. So we have a lot of people who help us on a daily basis. And even in the video, it was shown that even the novices are placed with us for a month from some congregations, and they really feel that this is a very good hands-on learning experience instead of just learning from the books.
Yeah.
So it is a very, very rewarding experience for everyone who is associated with the Ave Maria.
A question to you: it's free for all faiths, people
Yes.
who are in their last stages, and giving them opportunity to die in dignity. What about all these expenditure that are involved? How does it come through?
We get enough donations from kind-hearted donors, philanthropists. So far, we've not had an opportunity to ask the government for help. There is enough resources to run the facility, and I truly feel that it is a blessing from above. So we don't have to charge them. There is no bed fee. People can stay with us for as long as as long as they are in the end stages and they're not able to meet their needs. So if they get better, if they are physically okay, they can take care of themselves, we discharge them because we only have 15 beds. We discharge them, and we readmit them when they are very critical. Okay. So far, there has not been a finance. Initially, yes, when the building was just coming up, we had a very good contractor. Even though we owed him about 60 lakhs, he allowed us to start our services. And it took us 3 years to pay him off in installments. And we had a very humble beginning. But because of, I think, blessings and benevolence, there is absolutely no need for, many people ask us, how do you manage in these times? But I can honestly tell you that we get more than what we need.